Let's take a look at Anne Hathaway and figure out if she's had any potential facial plastic surgeries. Stay tuned for the side-by-side comparison over the years. Now let's go to the analysis board. 2006, at the age of 24, Anne has, as you can see, gorgeous hair. She has a short forehead right here. And when you look at the overall pattern of her eyebrows, you can see this fishbone type of very classic pattern to the eyebrows, the way that the hairs are arranged. So you have here the medial ones go straight up and down, and then as you start to come off laterally, you have this type of design forming. This is like a fishbone. And as you get lateral, they tend to fall laterally. And they stay very acute to the surface of the skin or of the face. She has very nice infrabrow fullness, so that's this area right in here. And when it comes to the area under her eyes, this is not fat herniation. This is actually prominence of the orbicularis oculi muscle that gives you this prominence. I have that too in my under eye area. So this is not to be confused with fat that over time can hypertrophy out. It's not what she has. This is just the hyperactivity of the muscle. She also has nostril show that is visible here and here. You'll also see that from the profile view as well. And she has some tip bulbosity. So this is the nasal tip right in through here. And there is some bulbosity to the tip, but overall, it's a very nice nose. Anne also has a very well-defined philtrum. So these are the philtral columns here. They're not straight up and down. They're on a bit of an angle. That's the way it naturally is. Also, look at her Cupid's bow. It's just like perfectly defined right in through there, as well as onto the sides. Very nice. And she has this slight gap between her upper and lower lips. So this area in through here. She has a slight deficit of the upper red lip volume, and that creates that slight little gap. But overall, the volume of her lips is really what she's known for. They're great. And she has this nice big broad smile. In 2007, at the age of 25, notice here the natural eyebrow shape, as well as the lateral canthus angle. So right here compared to right there. The lateral canthus will always sit a bit higher because of the flow of tears that go from lateral. Lacrimal gland, don't forget, is around here. So the tears will flow from lateral to medial. So naturally, we have the lateral canthus slightly more elevated than the medial canthus. When people get the cat eye type of lift, they get this less natural appearance where now the shape of the eyebrow is more like this, and the canthus is tilted much more, and that becomes less natural, right? So Anne looks very natural. And notice again that gap here that we were talking about earlier, that's because of this slight deficit of the red lip here that gives her a slight gap when the lips come together. And Anne has this really nice strong chin. You can see the chin definition all through here. And what that does is it really creates a nice acute cervical mental angle. And it does help to a degree delay the aging process onto the neck as far as the aging of the neck and laxity of the neck skin. And it also helps balance out her nose. Like we said earlier, she does have some tip bulbosity, but because of the prominence of her chin, they actually balance each other out quite nicely. In 2008, at the age of 26, notice how Anne has these little fine baby hairs right in through here at the hairline, and then right in through here. So as we do hair transplants, we always try to recreate the fineness of the hairline by only using single hair grafts. But oftentimes it's very difficult to get as fine as the natural hairs that live in that area. But we try. Also, notice how natural her supratarsal area is. This supratarsal show right in through here has this very nice platform, and the amount of show that you're seeing is just right. When the upper lid skin gets too redundant and starts to hang over the supratarsal area, that's when you start to get a reduction of that show, and that sometimes leads to someone looking more tired or older. Also, when too much of the skin is removed with a blepharoplasty, for example, then you get too much show. And that can look also, in a way, like to be aging somebody and looks less natural. Anne also has this nice cheek fullness that looks very natural. It does not look like there's been a filler added in or that there's been a cheek implant or anything like that. Notice the nice soft natural contours. It doesn't look like someone stuck a piece of silicone in there or that she's been injected with filler in that area. In 2008, Anne Hathaway actually commented on plastic surgery. She said this: "When I was growing up, I wanted a nose job because I didn't think my nose was good. And my nose is now, I think, what lets me change my face a lot," she said. "Your face needs to have character if you're going to be an actor, or you're just kind of a face. You're not really a person or a personality." So it seems that Anne considered a rhinoplasty at some point, but then decided against it because she felt that the nose helped define her and that it was a nice addition to her face, and I would agree with that. Subscribe and turn on notifications to be the first to see our new videos. I always do my best to engage with early comments. In 2009, at the age of 27, I see no signs of any procedural changes of her face. And that's the same through 2012. In 2013, at the age of 31, now Anne is in her 30s, and you can see increased crow's feet rhytids or wrinkles, and she still looks amazing. In 2014, at the age of 32, again I see no signs of change, and this is the same through 2017. In 2018, at the age of 36, Anne has more lateral upper lid hooding, and the eyebrows are showing early signs of descent. And this is just what happens as we get older, as we get into our mid and late 30s. That is very common. In 2019, at the age of 37, I see no change, and same in 2020. In 2021, at the age of 39, it seems like Anne has started to receive Botox for the forehead, glabella, and crow's feet. Let's go to the analysis board. Okay, so this is Anne at the age of 39 in 2021, and this is Anne in 2020 at the age of 38. And you can see in 2020 she had these rhytids, these wrinkles that were forming on the forehead. And when you look in 2021, you can see them here also. Wrinkles here, wrinkles here. When you look in 2021, it looks much smoother. I think it was around this time that she started to maybe get some Botox. And the Botox was performed into the frontalis muscle, which is the forehead. The frontalis muscle lives here, right in through here, and it extends back some. And so when you do the injections for the forehead with Botox, I usually like to leave a clearance zone for at least 1 centimeter above the eyebrows so that you don't drop the brows. So usually a little clearance zone. And so this is the area that you go in and you can inject some Botox throughout to smooth out those lines. The other common area to inject Botox into is basically the glabella area. So you can see she's got these little lines forming here, and then they're gone. For this area here, it's typically the corrugator muscles that live in this area and the procerus muscle that lives right here that you're targeting. So Botox can be injected here, 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 and sometimes centrally to reduce those different frown lines. And then lastly, for the crow's feet, look at this area right here. That's because of the activity of the orbicularis oculi muscle, similar to the muscle responsible for this area, just a different component of that muscle. You get these lines, so you can use Botox to soften that, and you can see the softening effect right in through here. You usually don't want to put Botox into this area because that can lead to some functional problems with the way that the eye actually works. In 2023, at the age of 41, I wanted to highlight here how spectacular Anne Hathaway's skin looks. She likely uses some combination of, say, retinol, which helps speed up cell turnover, and sunscreen. UV rays tend to cause DNA damage in the skin, and that can lead to premature aging and potentially skin cancer. So it's very important to use sunscreen. And she also likely gets a combination of regular facials, potentially some laser procedures to keep that skin as optimal as it can be, and maybe even some chemical peels. Now let's go to the analysis board. Here's Anne in 2023 at age 41, and here's Anne at age 24. And when you look at the vermilion border right here, this area right in through here, what you can see that's different compared to the age 24 picture is what's called the white roll. And it's this little prominence that exists right at the border between the red portion of the lip and the cutaneous portion of the lip. Right in through here, there's this little prominence. And it adds like this youthful softness to the lip that some people try to recreate with filler, but you can't really recreate it because it's not so much that it sticks out, but it's rather this little mound, and we tend to lose that over time. Now, the other point that I'd like to make is you can see the tightness of the face is also different. In the lower face, there's definitely some degree of droop of the skin of the lower face, right? Compare this jawline and how sort of tight that jawline looks and how pulled that skin looks. Compared to now 41, there is definitely some degree of drop that's occurring. And so some people will decide, hey, this is too much of a drop and I want a facelift. But I think Anne looks great at age 41 without any facelift. Something that is debated online is, has Anne had a rhinoplasty? And I even sent some of her photos to some esteemed colleagues of mine. And the overall assessment is that there's no signs of any obvious rhinoplasty. I think Anne's changes of appearance and her ability to conform to different roles and styling, I think that speaks more to what makeup can do, with the ability to contour the nose, to make it look straighter, to make it look thinner. And so she has really mastered that ability. So she can take her natural baseline nose and really tweak it in different ways with the use of makeup to give it slightly different appearances. Since you like this video on Anne Hathaway, click on our video of Lady Gaga to find out which potential procedures she may have had.